In the first section of our lecture, Inflammation of the Pharynx, we will talk about the adenoids and nasopharyngitis. And in this section, we will discuss what are adenoids, what are the signs and symptoms if the adenoids get inflamed and the adenoiditis is present. Also, we will talk about the acute and chronic nasopharyngitis. What are the signs and symptoms of acute and chronic nasopharyngitis? And also we will discuss about the disease known as the Thornwaldt's disease. So the adenoids. Adenoids are, if you see in this diagram, these are the adenoids present. So this is the normal adenoid, and this is the adenoid once it becomes enlarged and becomes inflamed, leads to adenoiditis. So this is the enlarged adenoid, and this is the normal adenoid. This is the eustachian tube. Eustachian tube is the tube that connects the throat or the pharynx to the middle ear and maintains the air pressure in the middle ear cavity. So adenoids are very closely related to that. They are present. This is eustachian tube. This is the maxilla. Then we have the mandible. Maxilla is the upper jawbone. Mandible is the lower jawbone, and the tongue. And here behind the nasal cavity, you can see this is the adenoids. This is the nasal cavity, and this is the adenoids. So that's the adenoids where they are located. They are at the junction of the roof and posterior nasopharynx wall. So this is the at the junction of the roof and posterior nasopharynx wall. That's the site where these adenoids are located or they are present. These adenoids are the lymphoid tissues. Lymphatic tissue or lymphoid tissues are the tissues that play a very important role in the immune system, and they are responsible for developing the immunity in the body. So they are the vertical ridges of the lymphoid tissue. Our tonsils are lymphoid tissue, adenoids are lymphoid tissue, the thymus gland which is present in the neck is the lymphoid tissue, lymphoid organ, and then once at puberty the thymus gland atrophies and shrink because after the immunity develops. So all these are the lymphatic organ or lymphoid tissues that play an important role in developing the immunity or immune system. So this is the location of the adenoids. The adenoids, they are separated by the deep clefts, and there are three types of epithelium that makes up the adenoid. We have the ciliated, pseudo-stratified columnar epithelium, stratified squamous, and transitional epithelium. So these are the three types of epithelium that make the adenoid. And it's a lymphoid organ, lymphoid tissue present at the junction of the roof and the posterior nasopharyngeal wall. So that's the site of the location of the adenoids. Blood supply, lymphatic drainage of the adenoids, and also nerve supply. So let's talk about that. The lymphatic of the adenoids, the lymphatics drain into the upper jugular nodes. So lymphatic drainage of the adenoids, it drains into the upper jugular nodes. The nerve supply of the adenoids is through cranial nerve 9 and 10. So ninth and 10th cranial nerve supplies the adenoids. The blood supply, the arteries that supply the adenoids, we have the ascending palatine branch of facial artery. Here you can see this is the facial artery and this is the ascending palatine branch. And that gives branches to the adenoid tissue. So we have the arterial supply. First is the ascending palatine artery from the facial artery that supplies to the adenoids. The other artery that supplies the adenoid, we have ascending pharyngeal artery, which is a branch of the external carotid artery. So this big artery here, you can see this is the this ascending pharyngeal artery, which is the branch of external carotid artery. So this is the ascending pharyngeal artery. Then we have ascending palatine artery. They both supply blood to the adenoids. Another artery that supply is the pharyngeal branch of the third part of maxillary artery. Here this is the maxillary artery and this is the branch that is given to the adenoid from the third part of the maxillary artery. This is also supplying the blood to the adenoids. Ascending cervical branch of inferior thyroid artery. So cervical branch of inferior thyroid artery also supply to the adenoid. So lymphatic fluid, lymphatic drainage of the adenoid goes to the jugular lymph nodes. Then the blood nerve supply is through the cranial nerve 9 and 10th. And the blood supply is mainly from the branches of the facial artery. Then we have external carotid artery, maxillary artery, and the branch from the inferior thyroid artery. All these arteries supply blood to the adenoid. Causes of the infection that can involve the adenoid leading to adenoiditis. Itis is inflammation, and when adenoids are involved, it is known as the adenoiditis. So what are some causes of adenoiditis or inflammation of the adenoids? And this inflammation can lead to enlargement of the adenoids and then different symptoms produced by those swollen adenoids. So the causes of infection, again, lymphoid hyperplasia. Whenever there is hyperplasia of lymphatic tissue, because adenoids are the lymphatic tissue, and the hypertrophy and hyperplasia of these lymphatic tissue can lead to adenoiditis. So lymphoid hyperplasia. Then attacks of rhinitis. If somebody has attacks of rhinitis, is the inflammation of the nose, and if there is constant history of recurrent rhinitis, chronic rhinitis, it can cause adenoiditis also. Sinusitis, also inflammation of the sinuses. We have paranasal sinuses, which are around the nasal cavity, which are the frontal sinuses. Then we have ethmoid sinuses, maxillary sinuses. All these sinuses, when there is infection, it can reach the adenoids also and cause infection in the adenoids and swollen adenoids. Chronic tonsillitis, another lymphatic organ. Tonsils are present below the mandible also. So these are also any infection of the tonsils can cause adenoiditis also. and then allergy of upper respiratory tract. So if you notice all the etiologies, all the factors that can involve the surrounding structures of the adenoids can cause infection of the adenoids also. So lymphoid hyperplasia, excessive growth of the lymphatic tissue, can cause adenoiditis or swollen adenoids, and then surrounding areas like rhinitis, sinusitis, tonsillitis, all these infections can spread to the adenoids also and cause adenoiditis, and any upper respiratory tract infections can also lead to the adenoiditis, and you can see the swollen adenoid present here. The symptoms are the different symptoms. We have nasal symptoms, we have oral symptoms. All these symptoms are associated with the involvement of the adenoids. So nasal symptoms are obstruction. Nasal obstruction is very common because of the obstruction of the nasopharynx and blockage. It causes nasal obstruction. Nasal discharge, as with any inflammation or infection of the nasal area. Sinusitis, epistaxis, and voice change. Epistaxis is bleeding from the nose, and then voice changes. Hoarseness of the voice is also present in this nasal symptoms of the adenoiditis. All these, if you notice, they are the cause of adenoiditis, and they can also be associated with adenoiditis, like sinusitis can cause adenoiditis, and if adenoiditis is present, it can lead to sinusitis also. So it's both way traffic. Then we have nasal discharge and voice changes. Then the oral symptoms of the ear, what are present, because if you notice, I mentioned that adenoid location is very close to the eustachian tube also. And this eustachian tube is responsible for maintaining the air pressure in the middle ear cavity. So swelling of the adenoids put pressure on the eustachian tube, and this can in turn lead to oral symptoms also. So there is tubal obstruction, recurrent attacks of acute otitis media, infection of the middle ear cavity, acute, recurrent, keeps on happening again and again, the attacks of otitis media. Chronic suppurative otitis media. There is pus from the middle ear, chronic suppurative. Serous otitis media. Then we have some general symptoms associated adenoid facies. This is a typical facie of the patient who have adenoiditis or recurrent inflammation of the adenoid. They have typical features known as the adenoid facies. Then we have pinched in nose because of that pressure or difficulty in breathing. They have pinched in noses. Pulmonary hypertension, the pressure in the lungs is increased because of the difficulty in breathing or nasal obstruction. Aproxia, that's the aproxia is the condition when there is lack of concentration. Concentration is also affected because of the nasal obstruction, difficulty in breathing. There is decreased supply of oxygen to the brain also, and then all that can cause decrease in concentration of the patient. So these are some very common symptoms associated with the involvement of the adenoids, and since all these structures are interrelated and very closely linked, involvement of one structure can lead to the involvement of the other. Diagnosis and treatment. This is the on this skull, if you see, this is the location of the adenoids, and that's where the tonsils are present. So tonsils and the adenoids are location. Diagnosis is rigid or flexible nasopharyngoscopy. So examination of the nose and the pharynx by the rigid or flexible nasopharyngoscope. Then lateral radiograph of the nasopharynx is also helpful. Treatment is breathing exercises, since it's causing the nasal obstruction, difficulty in breathing. Breathing exercises are important to teach the patient how they can breathe easily. So breathing exercises are important. Decongestant nasal drops to relieve the congestion and to breathe little easily. That's very helpful, decongestant. Antihistamines are also helpful, and then we can do adenoidectomy, which is the removal of the adenoids, and usually the patients who have recurrent episodes of adenoiditis like tonsillitis, the ultimate treatment is the removal of the adenoid so the patient feels better. So adenoidectomy is performed. Next is acute nasopharyngitis. Is acute short-term, short-duration inflammation of the nose and the pharynx. So it's nasopharyngitis. Causes are the upper airway infection. So if there is infection in the upper airway, in the nostrils, nasal cavity, that can cause the nasopharyngitis. Then we have the common cold. Viral infection is the most common cause of acute nasopharyngitis, and some bacteria like Haemophilus influenzae, which causes influenza type A, B, is also a very common cause of the acute nasopharyngitis. So upper airway infection, viral infection, and bacterial, which is Haemophilus influenza. Clinical features of acute nasopharyngitis are the dryness and burning of the throat. There is itchy sensation in the throat. There is dryness and burning of the throat. Pain and discomfort in the throat, especially on swallowing. Even on swallowing the saliva, there is irritation in the throat, that there is something present in the throat. That sensation is very common, that there is something sticking in the nose, in the throat. That's the common in pharyngitis. So pain and discomfort. Difficulty on swallowing. Pyrexia and enlarged cervical lymph node. There is fever present and there is enlargement of the lymph nodes in the neck. Cervical lymph nodes are enlarged. And also there is congested and swollen mucosa. If you look in the throat and if you examine the throat, you can see the redness and congestion, and there is swelling of the mucosa also. So these are very, very common clinical features of acute nasopharyngitis. There is congestion, there is difficulty in swallowing, pain, and there is burning sensation in the throat. Treatment of acute nasopharyngitis, usually if it's mild case like common cold, viral infections usually take its time and they recover spontaneously on its own without any antibiotic. Only sometimes the patient needs the symptomatic treatment, like if they have a headache or fever, some Tylenol is effective for that. But other than that, they sometimes the mild cases they recover spontaneously. Then analgesics are helpful for relieving pain, antibiotics for infection, chemotherapy is sometimes also effective. Then we have nasal decongestant drops can also be helpful in the treatment of acute nasopharyngitis. Now, the chronic nasopharyngitis, if the condition of acute nasopharyngitis persists for a long time, or if it's recurrent, it becomes chronic nasopharyngitis. And in the causes of chronic nasopharyngitis, we have infections of the nose, pharynx, and paranasal sinuses. So all these sinusitis, pharyngitis, rhinitis can lead to the nasopharyngitis, chronic nasopharyngitis. In heavy smokers and drinkers, chronic nasopharyngitis is common. Any exposure to dust and fumes. This is very common in people who have allergies to the dust and fumes that can cause allergic rhinitis and allergic sinusitis type or pharyngitis. They can lead to chronic nasopharyngitis. The features of chronic nasopharyngitis: there is post-nasal discharge, there is dripping of the fluid. Patient feel that there is dripping on the back of the mouth, on the back of the throat into the mouth. That's known as the post-nasal discharge. Behind the nose, it discharges into the mouth. Crusting with irritation. So now it's a chronic condition. The crusting is very common along with the irritation. Hawking or inspiratory snorting is common. The loud sounds are produced on breathing because of chronic nasopharyngitis. Congested mucosa or the mucopus, dry crust, and there is chronic adenoiditis. All these are the clinical features of the chronic nasopharyngitis. Treatment is alkaline nasal douche, and then we have steam inhalations, and no smoking is recommended for people who have chronic nasopharyngitis, chronic upper respiratory tract infections. Smoking is one common cause of recurrent infections of the upper respiratory tract, so smoking should be avoided. Then Thornwaldt's disease is a disease in which there is infection of the pharyngeal bursa, which is a median recess representing the attachment of notochord to endoderm of the primitive pharynx. So it's the infection of the pharyngeal bursa, and this pharyngeal bursa is recess that represent during the developmental stage. It represents the attachment of the notochord to the endoderm of the primitive pharynx, which is during the embryological period. Clinical features is persistent post-nasal discharge with crusting. So if you see the presentations are more or less, we have post-nasal discharge and crusting in chronic nasopharyngitis also. There is obstruction to eustachian tube and serous otitis media, dull type of occipital headache, recurrent sore throat, and low-grade fever. So all these are the features of Thornwaldt's disease, which is infection of the pharyngeal bursa, which is the median recess representing the attachment of notochord to the endoderm of primitive pharynx. Treatment is by antibiotic marsupialization of the cyst. You can see there is a big cyst, and it's the infection of that pharyngeal bursa. Bursa are the fluid-filled sacs, bursa. So this was all about the section 1 of our lecture. Thank you for watching sqadia.com.